Good morning. Welcome back. This morning on Public Affairs on Peach, we are taking a look at women's health issues and the importance of getting into the doctors for regular checkups. Of course, it is National Women's Health Week. Jamia Dorsey is the CEO from the Center for Black Women's Wellness. And Jamia, you're here with us this morning. It's good to have you here.
It's good to be here.
And it's good to be talking about this. And I'll ask you this because you're the CEO from the Center for Black Women's Wellness.
Yes.
I'll ask you, is there a real issue with black women getting to the doctor?
There is, and not even so much getting to the doctor, but also just some serious chronic health conditions. We know that, for example, diabetes, issues such as high blood pressure, that black women are disproportionately impacted by that. And there are a number of reasons for that. Some of it does have to do with access issues. So you talked about going to the doctor. There are fewer black women that are insured. Also, we know income plays a factor, but there are also some reasons of fear, which I guess all women sometimes have a fear of going to the doctor, especially for a lot of preventive screenings such as mammograms. And so there's some access issues, there are income issues, but then also unfortunately there's some issues related to lifestyle. And so one of the things that I think is great about this week is not only is it about trying to encourage all women to go to the doctor to get a regular checkup, but it's really about how do you incorporate lifestyle changes so that we can all be happier and healthier.
Yeah, and really, how do you convince a woman? You know, she a lot of times is taking care of the husband and taking care of the kids, right?
Yes.
But you know what? We're moving to a different day and age where women are sometimes the providers of the home, and they're bringing in the income. They're working full-time job. Right. So how do you convince, and how do you change this culture of getting women to recognize, okay, listen, at some point in the day, I need to focus on me. I've got healthcare issues, that can be preventable if I go to the doctors now. How do you change that culture?
It's a hard culture to change because women tend to be nurturers and they want to take care of everyone and they put themselves on the back burner. And so that's why this week is so important, because it's really about medical providers, the business community, and the overall community encouraging women, take charge of your health and take care of you first, because you can't take care of anyone unless you take care of yourself first.
And what are some of the basics? What are some of the basics that women who may be watching right now saying, listen, I may not have time for a whole lot of stuff, but these are the basics, these are the things I need to look out for, these are things I need to go to the doctor for now?
Right. So the first thing is to get a regular checkup. We often take that for granted. We see so many women who, after having a child, they don't even think about going to the doctor anymore for themselves. They're so focused on pediatric care.
What's the time period for when doctors and medical providers say go get a regular checkup? What is that?
I mean, once a year is good, but it really depends on if you're managing any chronic health conditions. You would probably need to go more frequently. For example, we actually have a free clinic, our Safety Net clinic, where we use volunteer healthcare professionals. Around 70% of the women that we're seeing in that clinic, we're managing for a chronic health condition. High blood pressure being the first one, diabetes being number two. These women come more regularly. But for your well-woman visit, your gynecological care, once a year is pretty typical. And
what do you tell the woman who may not, and Jamia, we know that there are women out there who just don't have health insurance, and what is available out there for them for a basic health screening?
Right, great question, and we're certainly available. We do provide affordable quality health care services for women, and most of those women are uninsured. And so it's a sliding scale fee, and so that is something that's available for women. We also have a chronic disease management clinic for women and men, actually. And there are a lot of other community health centers, and so we're fortunate in that there are medical resources in Atlanta. So not only is it important to get that checkup, but there's some other things that you can do independent of that. That's important, but there's certain things that we can do, like, for example, physical activity. We know it's intuitive and we hear about that all the time, but we know in Metro Atlanta, of course, it's hard. We're in our cars a lot, and so we've got to get moving. We also have to, of course, focus on nutrition and getting those whole grains, fruits and vegetables. And I know that sometimes it's difficult because depending on where you live, there's limited access to fresh fruits and vegetables. However, you know, we've really got to try to figure out some unique ways in which we can do that and allow ourselves that opportunity to have more nutritious diets.
Yeah, and it's also the affordability as well. You know,
Absolutely.
They always say, you know, fast food is just, it's quick and easy and it's cheap.
Right, but you pay for it later.
Yeah, you're going to pay for it later.
Right.
You know, yeah, you are. You're going to pay for it later, and it is still such a challenge, I think, for a lot of people to figure out how to feed a large family and feed them healthy food when they're always on the go.
It's true. We actually have a nutrition program that we're doing now where it's actually a cardiovascular disease prevention program where we're looking at nutrition, stress management, and I forgot to mention how important stress is and that the role that stress plays in poor health outcomes for women and men. And then we're also doing physical fitness in the way of Zumba. So that's like a wonderful, yeah, it's a great program for women, and it's free for any woman, but they have to have either they have to be overweight or they have to have high cholesterol for that program.
All right. Jamie Dorsey, we appreciate it, from the CEO from the Center for Black Women's Wellness. Appreciate your time with us this morning.
Glad to be here.
All right, a great issue to talk about. Stay with us. We're coming right back to wrap up the show.